have a surgery this morning on a young man who has cancer and he has no insurance. And I thought we passed the Affordable Care Act for just this guy, right? 16 years ago when I read that law, it became apparent to me that this is a law not for health insurance. It does not make anything affordable. It simply forces everyone to buy a sheet of paper that says they have insurance. And over the course of the 16 years, what I've found is that people who have bad insurance are worse off than those who have no insurance. Someone with no insurance can haggle a cash price, can get discounts from people. This particular patient has a health savings account, so he haggles a cash price and he shows up in cash. Who doesn't like cash, right? I pray for him that we don't find something that requires something serious like chemotherapy. But having said that, in the last 16 years, the healthcare system has not functioned for any part of society except the administrators who dole it out. So the doctors are getting squeezed, the patients are really getting fleeced. There's so many layers of bureaucracy between a patient and the physician that are put there both by insurance companies, the federal government, etc., that it's just not really a tenable situation. 16 years ago, 5 to 10% of doctors were employees of a hospital. Right now, it's 95%. In fact, I'm getting ready to join a hospital group for this reason. It's just you cannot run a solo practice anyway. This is impossible. It's impossible. Okay. So this is the background, which I get this email, not an email, it's my husband texted me this story. He's a doctor also, so we pay attention to these things. As you might know, Medicare is being audited like the rest of the federal government by the Department of Government Efficiency, which I'm okay with. You need to edit. Some of the stuff they're finding is egregious, but okay, fine. So audit. It's fantastic. Find me the money, right? Where are we spending our money? In an effort to make America healthy again, I encourage everyone to pay attention to this audit of the Medicare services because that system is collapsing under the weight of fraud and abuse, and we need it. You pay into that every single month for your paycheck, and there are people who rely on that in their older years as a means to take care of themselves. And so it's grotesque that people would take money out of that system in fraud.